Open enrollment season officially underway, and there are big changes you need to know about today. Andrew Rubin is with NYU's Langone Medical Center and the host of Healthcare Connect on Sirius XM Doctor Radio. Andrew, what better person than you to help me do this? Because I look at the forms, my husband looks at his, we have to decide what to do. Very big changes. What should you do first?
Well, I say it every year, and I do it myself, and it takes time. You got to read what your employer's offering. It's most likely has changed this year. Your co-pays have changed, your deductibles might have changed, your co-insurance has changed. And you're probably going to be offered more than one plan choice. So make sure you're looking at your choices so you understand what you're actually picking.
Good advice right there. Consider an HMO, stay in network whenever possible, and also let's talk about the second thing here. Wellness plans, preventative care plans. Don't just disregard those. You need to sign up for those.
You not only need to sign up for them, but more employers are offering them this year. I've looked at 3 employee plans for several friends of mine, and they all have this provision. And if you participate in the wellness program or go get your free screening, if you want to call it that, you actually get a lower premium for yourself in the coming year. So you want to take advantage of it if it's being offered, and it's good for your health.
I mean, we need to do everything we can to get our part of the healthcare costs down. We know they've been rising. Healthcare reform is not going to change that. Your portion, what you're paying for your healthcare folks, is still rising. That's another big thing why people use flexible spending accounts. But flexible spending accounts have very big changes. Very big changes. If you count on this to lower your healthcare bill, listen up.
Well, there are big changes, but first I want to say most people still don't use them. I don't use one, and I don't use one, and I need to, and I'm actually doing it this year. I'm also switching to an HMO this year to lower my costs. But flexible spending rules change in that you can no longer buy over-the-counter medicines with your flexible spending account dollars. So that's a big change this year for a lot of people. That being said, you can still all your prescription drugs, any portions of your health care expenses that aren't covered by your insurance company can still be used with flexible spending account dollars, and that's tax-free money.
What about over-the-counter kids' medicines, over-the-counter Tylenol, ibuprofen, that kind of stuff?
Over-the-counter medicines are no longer allowed to be used unless they're prescribed by a physician. So your pediatrician may actually say, you know what, I want you to take children's Tylenol, you need a prescription for this. And then
get the prescription so that when you're doing the paperwork with your insurance company, you can say, look, no, my doctor says I have to have this. I mean, a lot of people have emailed me about this, and they're very upset because they asked to them, to really smart planners, it's like a tax increase to them, because they have really worked this out where all the saline solution, the aspirin, the vitamins, all of this is something that they used pre-tax dollars to pay for. They're not going to be able to do that anymore.
That's exactly what it is. The money is going to be used to fund healthcare reform.
You folks in healthcare always tell me about negotiating in healthcare. Negotiate, everything's on sale. It's a service. Doctors and hospitals, just like everyone else, want your business. How do you negotiate?
All right, well, first of all, there are a lot of rules, and they vary from state to state, federal, you name it. So you have to make sure you're negotiating within the framework. The area you can negotiate most often is when you're paying for things out of your own pocket. So first you have to know the rules, and the provider has to know the rules. But if there's an opportunity to negotiate, all you have to do is ask. So there are a lot of non-covered services, for example. Just pick one and call the hospital, call the doctor and say, listen, I can't afford this, or I can't pay you the full amount. Can I have a discount? More often than not, they'll say yes.
All right, Andrew Rubin, thanks so much for great advice. Go with an HMO if you can. Pick generics. Take the wellness plan if they offer it. But first and foremost, read all that stuff about open enrollment, because it's incredibly important. Great advice. It's why, frankly, I trusted you so much for writing my book, Smarter Than You're Rich. Thank you. I thanked you in the book, but thank you again for everything. We'll talk again very soon.
Good information.
All right.